Hello everyone, I'm Jeff Gianola here at Coin 6, and this is a very special Facebook Live we're bringing you. We're answering the facts about the coronavirus, or COVID-19. I'm joined by Dr. Jennifer Vines, the Multnomah County Regional Lead Health Officer. Jennifer, thank you for being here.
My pleasure.
And Dr. Steve Krager from Clark County, he's the Deputy Health Officer there. Thank you both for being here. Let's start right off by talking about coronavirus, COVID-19. We hear both of those terms being expressed out there. Dr. Vines, what's the difference?
So coronavirus refers to a family of viruses, some of which we know a lot about as causes of the common cold, and some of which are commonly tested for as people seek healthcare routinely. Novel means new, and that's the concern in this case. We think that this is a new virus that started in China that has jumped into people and is now clearly being spread easily person to person. The fact that it's new means that we're still learning about the virus as we're responding to it. There is no vaccine, and in order to sort of shorten the terminology, novel coronavirus that originated in Wuhan City, China has now just been called COVID-19.
Okay, so that's when we say COVID-19, that is the virus from Wuhan, China.
Correct.
Okay. Steve, I want to ask you this. So there's a lot of parents watching this, and kids get colds. I mean, that's the time of year, and they're coughing. And right now the panic is, oh my gosh, my kid might have the coronavirus. How do you reassure parents?
Well, a couple things. There's a lot of things we don't know. We don't know exactly how widespread it is in the community. So it's tough to say, if someone has a cold, whether they have coronavirus or not. However, public health here is doing a great job of tracking down cases and making sure that people who had close contact with that person are being watched carefully. And so we're hoping that, if more cases pop up, we'll catch them. And the second part I would say about kids is that for whatever reason, and something we're researching, it doesn't seem to affect kids as severely as adults. So younger children, even adolescents, seem to have a very mild disease similar to a common cold for the most part. So it's something we're keeping an eye on, absolutely, and we don't want anyone to get this virus. But in kids, we at least have that knowledge that it isn't affecting them as severely. And yeah, maybe you can talk more about what it looks like in the community.
Well, yeah, Jennifer, if there's someone at home thinking, oh my gosh, I kind of got a cough, I'm not sure, what should they do?
So we've been really clear in our messaging that there is a spectrum of illness. The majority of people recover from this virus without needing medical care. About 15% are considered severe and 15% critical, 5% severe. So what we know from other countries is that most people recover. It doesn't seem to affect young children in a severe way, although there's always a spectrum of illness in all age groups. I think to your question about, your question was?
Well, kids normally get coughs,
yes.
or people normally get colds.
Thank you.
But now there's this panic element of, oh my gosh,
yes.
the coronavirus is out there. When should you seek help?
Yes, so thank you. So we are saying, with all of those caveats around children, we are saying, number one, everybody should stay home from work or school at the first sign of illness. We at least have, this whole situation has evolved, at least on the Oregon side, very quickly, on the Washington side too. And so we are still identifying cases, tracing those close contacts, but we are preparing for the potential for widespread community transmission. So the first thing is, if you're not feeling well or your child is not feeling well, stay home. And the second is, please don't seek medical care unless you otherwise would. So at least on the Oregon side, we don't have COVID-19 testing available at the scale to test everybody who's simply worried. So we're asking people now, again, to relieve the burden on our healthcare systems to stay home and only seek care if you otherwise would need to.
Okay, let's talk about that testing. In the news, we've been hearing a lot about that. How about Washington? Do you have the testing kits now that you need?
Well, it depends on how you define need. I mean, we have testing kits. There's two places that are testing in Washington. So there's the public health lab in Shoreline, and then there's the UW virology lab that just got going today, I believe, with testing. It's not, we're still prioritizing testing is how I would put it. So those with kind of severe illness that we haven't found another reason for those that are more vulnerable, so severe illness and they have underlying health conditions. Or if you're connected to a case, that would be another reason we would test. The other kind of priorities is if it's within an outbreak, and unfortunately in Seattle, they've had an outbreak at a nursing home, and so those cases are also being prioritized, so we can track those cases down as well. Healthcare workers are being prioritized to make sure that if they are ill, that they are not spreading it as well. So that's kind of that's how the priority is working. The testing capacity is growing, and so more and more testing will be available, but we're not quite at meeting everyone's demand right now.
Is that the same in Oregon?
It's similar in Oregon. We are also prioritizing people who are very ill, who appear to have what we think are the classic symptoms of coronavirus, which is like a viral pneumonia or an infection deep in the lungs. We are prioritizing also for people who are hospitalized, who have already tested negative for influenza. Those are candidates for testing. We also would prioritize contacts to known cases, and then others if someone has a travel history and consistent symptoms. If there is some other reason, there is some room for discretion. But I think the key message for anybody listening now is that unfortunately demand is not in sync with supply right now on the Oregon side. So again, only those hospitalized or those who have known exposure through travel or through contact with a known case are being prioritized for testing. We do also expect to have testing coming online in the coming weeks.
I would add as well that in general, that's the safest thing for everyone, is to stay home when you're sick, kind of regardless of whether this is going around. And, if you're going out to a healthcare setting and you're not that ill, you still might be spreading something to other people. So staying home if you can and don't need to go to the hospital because you're feeling short of breath or something like that is honestly the safest thing for everyone right now.
Okay, here's the question that comes up, especially here in Oregon, because we have spring break coming up in a couple of weeks. We're starting to get questions on our Facebook page. Should I cancel my trip to San Francisco or up to Seattle, or I'm going to fly across country? Forget about going out of the country, but this is just domestic travel. Should I cancel my trip? What would you say to that, Dr. Vines?
So I always point out to people that anytime human beings mix, there is some risk of disease transmission. That said, to my knowledge, there is no Centers for Disease Control guidance right now limiting domestic travel or limiting mass gatherings or people coming together. I think people have to make their own choices, knowing that people who are older and people with underlying medical conditions are at risk of more severe disease. And again, we all make our own choices. If good hand washing, definitely not traveling if you are sick would be key points that I would highlight.
Okay, we talk about hand washing and clean. So even here at Coin, and I know a lot of businesses and schools do this, they're having a deep cleaning. And some people say, that's okay, but the most important thing is wash your hands, right?
Absolutely.
Okay.
Yeah, I mean, you can do a deep clean, it's not going to hurt. And,
You're right.
And in surfaces that get touched a lot, it's always a good idea to clean those, at least daily. But if we're talking about transmission and how this disease gets passed to one another.
In other words, we could deep clean this whole table, but if you have it and kind of cough and I'm near you, it doesn't matter if this is deep cleaned.
That's right.
Okay.
Yeah. And that's how most disease transmissions, that's how most of the time it's being passed. It's from person to person and very close contact. So people, husband and wife, healthcare workers that are close to someone and talking to them and maybe getting coughed on and not wearing the correct protective equipment, that's where most cases are happening. So, we can clean and that's great and we should clean, but that's not how the majority of cases are coming about.
So, Dr. Vines, would you say the same thing? The most important thing when it comes to cleaning is cleaning yourself?
Definitely. I would also add that coronavirus is not a very sturdy virus. There's a lot of speculation about how long it lives on surfaces, whether that's hours or days, but the bottom line is that it's killed by most household cleaners. Often you can check the label and it will say that whatever you're using will usually mention coronavirus, for example. So it does respond to most cleaners, and it responds best to just washing your hands with soap and water, or if you don't have that, hand sanitizer.
Okay, and then the controversy over the masks. Everyone is out of the mask now, and I see you're kind of chuckling about it, but give us the bottom line when it comes to surgical masks.
No, I'm not, I don't want to make light. we're in a serious situation now. We're paying really close attention. My reaction there was just, the mask. It's the mask question.
Yeah.
Comes up a lot.
So it comes up a lot. So here's my answer to the mask question. Healthcare. I set healthcare aside in terms of its risk because, by definition, people coming in are sick, and so sick people who should be offered a mask when they come into healthcare. That's just to contain those droplets so that they keep their coughs and germs to themselves while they're in the healthcare setting. Healthcare providers, especially those who are doing certain procedures that may sort of send the virus up into the air, are recommended to wear a very special type of mask. It's referred to as a respirator, but it looks like a mask, but it fits very tightly, and it has to be fit tested, which means it has to be checked to make sure you have a good seal around your particular face, and you have to use it correctly in order for it to work. So that's healthcare. For everybody else, there is no recommendation to wear a mask in public if you're just out walking around. It's unlikely to protect you. The science there is quite mixed. I also point out that back to just not having washed hands, if you're messing with the mask and you're touching your face or you're adjusting it or scratching your nose, it's really not going to do you any good. So there is that false sense of security piece.
Well, people are, in cases like this, whether it's deep cleaning or the mask, everyone's looking for that security blanket when it comes to this. And do we come back to the best security blanket is just washing your hands and just being observant?
I think there's a few things we can look at. Washing your hands is absolutely paramount, and washing your hands correctly. So the front and the back of your hands, your thumb, your fingers, and doing it for at least 20 seconds. That is a lot longer than you realize if you actually count it out. People will say, saying happy birthday twice or do the ABC songs for kids. Those are great ways to make sure you're washing your hands long enough. Other things we talk about, and the reason we talk about these things are because they work. They've been shown to prevent these types of viral infections. So covering your cough, staying home when you're sick, not touching your face, which kind of goes to that mask piece. If you're adjusting things, that's another time that you touch your face. And if you start paying attention, you will realize that you touch your face a lot during the day. And that's how that virus gets into our body. So those personal steps are hugely important. Staying home when we're ill, and the other thing I would add with that is not exposing coworkers. So it's things the community can do to help prevent this disease from spreading. They are going to work as well. Those are other things that we can do to keep ourselves safe.
Another issue that comes up is, for instance, I have a brother-in-law right now in the hospital. It's when we have an outbreak like this, should we avoid maybe visiting people in hospitals? What should we do when it comes to healthcare facilities? And I think about this because of the facility in Kirkland, where that's the epicenter in Washington, where we've had, 9 deaths, 10 deaths? And should we avoid visiting people in health facilities right now, whether it's a hospital or a long-term care facility?
Absolutely. The advice of staying home if you're sick, it applies across the board. It especially applies if you are thinking of going into a healthcare facility or into a long-term care facility. In the Portland metro region, we are really putting out the message of limiting visitors to 2 adults, if at all possible. If you're going to visit someone in a hospital, making sure those 2 people are well. Understanding that different families and different cultures have different practices around visitation, and so hoping that for those groups who like to have a lot of people at the bedside, make extra sure those people are well, and again, also asking policies to flex, asking hospitals to flex their policies according to the specific circumstance.
Is the same going on in Washington?
Yes, we haven't developed that as formally, but we would say the same thing. It's helpful to limit a lot of visitation, and I mean, we go back to if you're sick, you should stay home kind of regardless, no matter where you're going. But yes, if you can limit the number of times that you're visiting people, just as a precaution at this time, it does make sense.
Okay. The other issue came up, and we may break here, everyone on Facebook, to do a live news cut-in so our television viewers can answer questions as well. And I think we're about to go to that right now. Well, we've been on Facebook Live here for since 4 o'clock, and I'm joined by Clark County Deputy Health Officer Dr. Steve Krager and Multnomah County Regional Lead Health Officer Dr. Jennifer Vines, and you've seen a lot of Jennifer on our newscasts. And one question that comes up when we talk about the coronavirus, we have spring break coming up, and I was asking about travel. A lot of people now are canceling travel plans. I'm talking about domestically, even going to San Francisco or Seattle. Should they be doing that, Dr. Vines?
So again, I think people have to make their own choices around the risk. There is no current guidance from the Centers for Disease Control around limiting domestic travel. I always offer up that anytime people get together, there is some risk of disease transmission, sort of regardless of the circumstances. I think as people consider their plans, they need to understand that what we know from other countries is that people who are elderly, people with underlying medical conditions, are the ones that appear to have the most severe illness. So taking that into account with your travel plans, and again, making your own decisions. Again, guidance may change, but that's
another question that came up, and I'll go to Dr. Krager on this. People who currently have a relative or a friend in a hospital or a care facility, should they think twice before visiting those facilities right now?
If they're feeling ill, so coughing or really any sort of other illness, absolutely they should not be visiting. In fact, they should stay home as much as possible. And then otherwise, feeling well, it would be helpful to limit visitation. Just numbers, I know you were talking about limiting to 2 adults, I think, per day. Is that kind of the guidance? So I think that makes a lot of sense. Things are going to change as this evolves, so keep a close eye on what public health is saying, but that's our recommendation right now.
Okay, Jennifer and Dan, we're going to continue this conversation on our Facebook Live, and we'll be checking back with you later in this hour. Okay, Facebook audience, we'll continue right now with more questions. This, to me, was fascinating, and I saw this question today, I think, from the Washington Post, but people are starting to ask this now. Is it safe to receive a package from an area where COVID-19 has been reported? And Dr. Vines, you may have answered this earlier. We're saying this is a very fragile virus, but should we be concerned about packages like that come in from Amazon, from places that might have had an outbreak?
So it's a good question. It came up a lot, especially when everybody was very much focused on China and things being shipped from China. The best thinking is that any package, even if it's contaminated with this COVID-19 virus, as it's being prepared to ship to you, chances are by the time it gets to you, there's no longer any virus there that's going to make you sick.
What would you like to add to that?
Not really much else. Yeah, there's one other virus that we know, norovirus, that's very hardy. That causes, vomiting and diarrhea.
We report on norovirus all the time. That affects healthcare facilities and schools a lot.
Yes, and unfortunately cruise ships. And that is known as kind of a hardy virus that can live for a couple days or so on surface. Other coronaviruses do not have that capability to live for so long. They're different structures in how they look, and they just don't have that capability.
Okay, here's a question for Dr. Vines. Why haven't they told us where the Oregon patients went before they were diagnosed? So people want to know if there's a case here in Oregon, they want the information. Where was that person, or where they, and how do you answer that?
Sure. So I'm assuming this question refers to the case out of Washington County, just to our west, that was confirmed late last week. So that was a confirmed case. In public health, we walk many lines around protecting patient privacy, and also there are some protections around our public health investigations. But our job is to confirm the case and then carefully retrace where that person was, figure out who had close and prolonged contact with that person, and then make sure those people get the message that they need to stay home and be on symptom watch for 14 days. So all of that played out, and unless we need to notify the public of an exposure, we typically don't, as long as we're able to directly reach individuals about their risk.
Do we know if people who arrive at PDX are being screened if they've come back from overseas, like China, Italy, or Iran, where they've had outbreaks there? Do we know if people arriving here in PDX are being screened?
I know for China, for sure, people are being screened. I don't know if you know, Dr. Vines, about Italy and South Korea, if the CDC is doing that same screening right now.
Not to my knowledge. I know travelers from China early on were funneled to specific airports in the United States. I think as things grew quickly to other countries, it's not clear from Centers for Disease Control if they're going to be doing the same type of tracking on reentry of those travelers. So we are not learning about those travelers. I don't know at this moment if PDX if they have anything in place around travelers.
And there's a lot of voluntarily people have canceled plans, whether it's a gathering or people. I know we were looking forward to having a French student stay at our house. My daughter's a sophomore, and she's a sophomore in France, the student that was going to come over. And as soon as it started, I told my daughter, I said, don't be surprised if this program's canceled. And sure enough, it was. So a lot of disappointment, but you know, hopefully maybe later on in the year. Does this, like the flu, we know there's a flu season, and this goes, is there a season when it comes to COVID-19? Will we start to see cases decrease in the next few months?
So again, this is a new virus, so we're still learning about it. I think there's some hope that as the weather warms, that we'll see less transmission. Whether that's because the virus acts like flu versus just people kind of being more spread out or spending more time outside rather than in close quarters, it's going to be hard to say. So again, we're just still learning about this virus. My fingers are crossed that the warmer weather might help decrease transmission, but it remains to be seen.
There's some early reports in China that they're seeing less and less cases, but how reliable is that information?
I think it's pretty reliable. I mean, they set up systems very quickly to track and test people, and lots of testing, at the same time. So, I mean, we can trust our own data for sure. It's harder to trust in other countries, but I think they've been pretty open and transparent for the most part. And I think we can take a little bit of solace in the fact that their numbers are decreasing. I think that's it makes me feel a little bit better, whether they, some of the actions they have taken are working, or whether the disease and virus is just kind of running its course.
Okay, well, I guess we'll have to wait on that.
Yes.
And just a basic question, I guess we can't hit on this once again. So someone watching this, they just want, how can I keep my family safe? What's the basic, and we might have covered this, but I don't think we can cover it enough. What would you say to that, Dr. Vines, if they're just joining us on Facebook?
Yeah, so I'll hit the highlights, and I can raise something that we haven't talked about yet. So for anybody who's just joining us, it's stay home if you're sick. Definitely stay out of healthcare systems and long-term care facilities if you're sick. Cover your coughs and sneezes, and by all means, wash your hands regularly. I want to bring up the flu vaccine, because we do still have influenza activity in our community. The Centers for Disease Control are saying that the flu vaccine is a pretty good match for the viruses that are in circulation.
Are you saying the flu vaccine that we've had this year might help prevent COVID? Might?
No.
Okay.
I'm not saying that. I'm saying the symptoms of COVID-19 overlap so much with influenza that my advice would be, if you haven't gotten this year's seasonal flu vaccine, it is not too late, because flu seasons can extend well into the springtime.
You're saying let's not forget about the regular flu.
I'm saying for anybody who is worried that they're going to get a cough illness and then be afraid that it's COVID-19, you may lower your chances of that worry by getting the flu vaccine, because we know that we have flu circulating in our community.
Okay. Dr. Krager?
I completely agree. In fact, the tracking that we're doing in Clark County shows that there's two basic types of influenza, influenza A and influenza B. The first part of the season we had influenza B, but now we're starting to see influenza A go up. So we're kind of having, it's not quite another peak, but the season is extending. So it's always a good idea to get the flu shot, and it's not too late to do that right now.
Who is most at risk for severe complications? Because on the news we're reporting people are getting COVID-19, but they're not having any serious symptoms. They're testing positive for it, then other people are dying from it. So who's at most risk when it comes to a severe case of COVID-19 or a fatal case of COVID-19?
Yeah, so typically with any infection, there's always what we call the spectrum of illness. So some people, and you hear reports of this, some people test positive and have no symptoms, and then you hear, death at the other end of the spectrum, which is absolutely tragic. What we've learned from other countries is that we think the majority of people have a mild illness that they recover from on their own without needing any medical care. About 15% of cases will be severe and 5% critical. And then among those more serious cases tend to be older adults and people with underlying medical conditions.
This is interesting. Before we began our Facebook Live, Steve and I were talking, and I said, you know, there's no silver lining with this, but if there's one positive that comes out of this, I think this has really made people aware that, you know, in this day and age where we think there's a vaccine for everything and a cure for everything, we have Mother Nature can crop up with something like this that catch scientists and doctors off guard, and it takes us time to respond. Human beings are very vulnerable, aren't they?
Absolutely, yeah. And even your seasonal flu can unfortunately be very severe for certain people. We're still learning a lot about COVID-19 and exactly how severe it is for certain groups of people. But I agree with kind of that there's a little bit of positive. If more people wash their hands more often, we're going to see less illness, viral illness in general. If this helps companies and businesses and organizations have better sick policies so that people can stay home when they're ill and they don't feel like they have to work, I think that's a positive as well.
And Dr. Vines, do you think, let's say we're in the future now and the COVID-19 crisis is over, do you think there will be valuable lessons that we've learned from this? And what would some of those lessons be?
Absolutely, absolutely. The last time, sort of in my career, that we contemplated something like COVID-19 was when the H1N1 new flu strain emerged in 2009. That was different in the sense that we had technology to create a vaccine, and so a lot of what public health was doing was trying to get antiviral medications to people and doing things to try to just stem the tide of severe disease until we had a vaccine online. So this is different. I think what we're going to learn from this experience looking back is what happens when you close schools. How early does that have to be to prevent transmission? There's a lot of talk about that. In Oregon, we are not at that threshold, but there are a lot of questions and not a lot of science to tell us the best time to close schools. And then if you do close schools, does it help? And then what are all the unintended consequences and all the cascading effects of kids, for example, not getting school lunches or parents missing work? So I think when we don't have medicines and vaccine at our disposal, we have what we call these social distancing measures, and so which ones work and what's the right timing because of the disruption factor. I think it is a big question on all of our minds right now, and that in hindsight there may be some lessons there.
Shuli just handed me a few more questions that came in on Facebook Live, and I think you might have answered this. It was one of our earlier questions, I think our very first question, but I'll send this over to Dr. Krager. What is novel coronavirus? What does that word novel, why do we say that?
So we say novel.
Novel, okay.
Yeah, like a novel. But it means new.
New.
That's all it means. So new coronavirus, novel coronavirus. We use all sorts of
Because we have the family of coronaviruses,
right,
but this is something new in that family.
Exactly.
That we haven't seen. And we nicknamed that or called that COVID-19.
That's
correct.
Okay, there we go. Another question that came in, we've answered this too, but if it can't live on surfaces for very long, is deep cleaning a waste of time? And I think we've answered this. It's not necessarily that it's a waste of time, but if we were to deep clean this table right now and sanitize these chairs, if I came in and was infected and was talking to you and started coughing, it doesn't matter what was deep cleaned, right?
That is true. So I think basic cleaning is important, especially those high-touch surfaces like doorknobs and shared computer keyboards and things like that. Obviously, washing your own hands regularly is a message that we're really putting out there. I think that the deep clean, I understand the instinct to want to do it. I'm not sure it's where people's time and energy and resources are best spent in terms of how to prepare and respond to this virus.
Put your time and energy right here and in covering coughs, and that's more important than deep cleaning all the hard
Right,
surfaces.
and having good sick policies and thinking through, who are your essential employees, what are your essential functions, making sure hand sanitizer is available, making sure your bathroom is there with, good running water and paper towels. It's those basic things that I think those of us in public health are really pushing.
More people are joining us, and some of these questions we've answered, but we answer them in a different way too.
Sure.
What should we expect in the coming months? How long will this continue, Steve?
We don't know. Yeah, we have hopes and we have kind of some expectations, but everyone's going to be different. Kind of every country is going to be different in how they respond. If we are able to slow the spread, it's possible that we might have it might last a little bit longer but be less severe. That's possible. But again, we don't really know. We can look to China, and it's been about 2.5 months that they've been dealing this, almost 3 months, and they're starting to see a decline. That's just one example, but we really don't know.
You're keeping your fingers crossed for that. I heard you say that, Dr. Vines, as the weather warms up.
Possible.
Okay.
I think we will see more cases. I think that's going to be for a couple of reasons. One is I think this virus goes from person to person relatively easily. Mm-hmm. I think we have community transmission because, again, we have confirmed cases who didn't travel. So I think we have it in our community. And I think as testing ramps up, we're going to find more. And hopefully we're going to start to understand better who is at risk and how it's passed around and how effective our public health interventions are.
Here's a great question that came in thanks to our Facebook viewers right now. Someone wants to know, what are the risks for pregnant women?
That is a very good question, and this comes up because I think we've come to understand that pregnant women are at high risk of complications from influenza.
Yes.
And in people's minds, there's a lot of understandable comparisons there. To my knowledge, there's no specific risk known to pregnant women, but there's very little science. So I think that's an area where we need to do some learning, and I think where we are naturally cautious about pregnant women. What would you add?
I completely agree. We have very preliminary data from China, but it's hard to draw conclusions from it. So it's better to be on the safe side, and pregnant women should take precautions, but not necessarily any extra precautions, but the precautions you take when you're pregnant. Washing your hands, staying away from other ill people, those sorts of things.
How long are you sick if you get it? How long are you sick for if you do get coronavirus?
Mm-hmm. So again, there's the spectrum of illness. Some people will have mild illness, some people will have severe. So I would imagine that for somebody with a mild case, it would look like another viral illness of being ill, sick, feeling kind of bad for 3 to 5 days, and then starting to feel better. That said, there are reports of China of people needing intensive care type care for several days and some weeks. So I think it depends on the individual.
One of the saddest things from China were some of the health professionals who were the ones in the forefront of this, the public health officials there. Some of those people died from the coronavirus. And as a public health official, that it must be very sobering to realize how important your jobs really are in letting the public know. But to know that public health officials in China died, and one of them was the doctor who had first warned everyone about the coronavirus and was sort of poo-pooed, saying, was kind of punished for that, and he ends up to die. It just tells you how important public health is and how important it is that we don't cut dollars from public health, because now we're finding out, let's not relax. There could be another coronavirus, a COVID-19 around the corner, right?
Absolutely, yes. Unfortunately, funding in Washington has been a little bit hard to come by for public health. And it helps us prepare, it helps us hire staff, it helps us write plans and research, and so funding is very important.
Well,
Absolutely.
Here's a question that came in. Why has it taken a week for Clark County to get results?
That's a great question. So I think it goes back to kind of the prioritization. And so what is happening in Clark County is hospitals are collecting specimens, and then they're sending it to the public health lab. And then, unfortunately, for at least most of this last week, that's the only place that has been doing them.
Yes.
And as we know, most of the cases are in Seattle and Snohomish County. Some of those cases have been kind of the way I understand it, they've been prioritized more because they were connected to known cases. We will get results. We don't know exactly when we're going to get them, but it's something we're keeping a close eye on, obviously.
So I was struck by something today on CNN. When I was watching CNN, they had a graphic on how many people, current cases. And in the time they made that graphic and put on, it had gone up 10. I mean, this starts to go exponentially at some point, and it starts to go up there. And what struck me about that was we're only reporting on the news the known cases. You know, I know in Washington there's concern that it had been there for a while, and it's not that. Is what we're reporting and what we're seeing now just the tip of the iceberg, do you think? I mean, could, you know, we act like when we report it, those are the set cases of what we have in the set deaths, but that could just be the tip of the iceberg, right?
I think I agree with that. I think we are set up right now to test the sickest people, and so the people we test are the cases we confirm. The assumption in public health is that for that tip of the iceberg, there are people who have very mild illness who never come to medical attention, or who simply don't meet testing criteria at this moment because our testing capacity is still coming online. So I think as we think about these cases that have come up in Oregon and in Washington with no travel exposure, we have to assume it's here. We just don't yet quite know how widespread it is or how bad it's going to be.
Okay. You want to add to that, Steve?
Yeah, I agree. We're watching very closely, and we're preparing for more cases. And I hope it's not a lot, but there's certainly more than we have caught right now.
Okay, there's talk, and the president has talked about this, but he wants a vaccine developed really quickly. What is happening now behind the scenes when it comes to a vaccine? Are these the pharmaceutical companies developing this in conjunction with public health officials? What happens? I'm curious about that. How is this going right now? And realistically, when could we see a vaccine for this?
So it's a great question. I am not a vaccine development expert. I would say that what I've heard is a vaccine could come online as soon as a year, probably more like 18 months or even 2 years. Mm-hmm. So at least in our public health thinking and planning, we are not counting on a vaccine in our toolkit.
Okay.
Yeah, and it can, I read an article that 20 different organizations, businesses are working on a vaccine, and it's a multi-step process. You have to create something that you think might work. You have to test it on a very small amount of people, or animals first, and then people, and make sure that they handle it well, and then you have to test it and see if it actually works, and that just takes months.
Well, you said animals, and we have a question here. You know, a lot of people love their dogs around here, and they say, how does COVID-19 affect animals? Should I worry about my dog?
I think to the best of our knowledge, we don't think pets are at risk. We don't think that humans can transmit to pets. That may change as people start to really look into this question, I think, given the community concern. So I think I have seen guidance that other countries are using around if you are ill, separate yourself from household members and pets as a precaution. But I just don't think we have the science at this point. Do you know?
I have not heard
differently.
Much
okay.
I'm not sure either of you will have the answer for this, but there's concern that when tests do become more widely available, will my insurance cover that? Will these tests be astronomical, like thousands of dollars for a test? I think the federal government is working to make those tests relatively free, but I don't know. Do you have the answer to that at all?
We don't know for sure. I do know at least the Washington State Public Health Lab is not charging people. I heard a preliminary number for the University of Washington lab that it would be $200. Whether insurance covers that or not, I think is mostly up to the insurance company. There might be some government regulation that could affect that, but I'm not 100% sure.
So we've talked about a lot of facts, but what are some of the number one misconceptions about COVID-19, the coronavirus? Jennifer, what do you think?
I think, I might use this question to go back to something you brought up earlier about the Chinese physicians who first reported from the front lines. I would say a couple of things. People may not know that local public health is set up to take disease reports and to be on the lookout for outbreaks of potentially new disease. So by law, healthcare providers and labs actually have to report a set number of diseases, including ones that are that can be sort of mystery illnesses, if there's enough of them, they're actually required to report them to the local public health authority, which is the county in Oregon. And we follow up on those reports, and it's typically confirming the diagnosis, finding people who may have some disease risk themselves, and then making sure those people know what that risk is and if there's any actions they can take depending on the disease. So a lot of this is the local public health system doing its job, and especially working as a system with our state, which provides in Oregon, it's similar to Washington, provides a state public health lab, which has brought the test online. For a while, you could only get testing through CDC, which was a really long turnaround. So I think in Oregon to have it locally is a huge asset. And it is without cost at this point. So we have a public health system designed to detect and respond to diseases. We also really rely on our frontline healthcare providers, and I'll use this moment to really recognize their work on this, because we ask them to be on the lookout for cases. They also have precautions they need to take to protect themselves. And I think, again, with a new virus and limited testing, I really applaud our frontline healthcare workers who are doing this work day in and day out, trying to sift through who has the flu, who does public health want to hear about. We've had really excellent partnerships here in the Portland metro area.
And maybe if something good can come out of this down the road, is that it's going through this COVID-19 crisis would inspire another generation of young people to really get involved with public health, to say, I remember that, and it is such a valuable service, and kind of unsung heroes on the front lines that someone wrote in, what's the difference between an outbreak and a pandemic?
So an outbreak could be very small. An outbreak could be 2 or 3 people within a school.
You were saying identifying that in the local community.
Exactly.
Yeah.
Yes. So within a confined kind of space, a nursing home, a hospital, a school. So cases just within that small kind of community. I've heard different definitions of pandemic, and what exactly makes a pandemic is a little bit unclear. But my understanding is that a disease that is completely global, transmitting kind of everywhere at a pretty large scale, is considered a pandemic.
Okay. How would you describe it?
No, I think that's right. We go from, so public health terminology here. So
Yeah.
Cluster is usually a sort of a small group of cases of concern. Outbreak tends to be a little bit bigger. Epidemic means widespread disease transmission, and there is a technical threshold for a pandemic. I want to say it's epidemics on 3 continents or something like that, but it means like global level epidemic.
Okay, so far, do you think, from what we've known, is there any improvement you'd like to see in the response to this, maybe at the federal level? I'm sure you would like to get those testing kits quicker than what you're seeing.
I think having more testing capability would be helpful. I understand that I believe the CDC is working very hard, and they are great professionals working there to get those test kits, as quickly as possible. That would be probably the most helpful thing. I think in general, just funding for public health from a federal level and a state level, just recognizing it as something that's kind of unsung, not always in the limelights, but a critical part of infrastructure for our society.
In about 1 minute, we'll be just interrupting the Facebook Live to go live on Coin 6, the 4 o'clock news, where the doctors will be answering some questions. But a quick one before we get to that. I just lost my question. Oh, can I catch it if someone with it was at my grocery store? But that depends on where you ran. If that person was over in the meat section and you over here, you're not going to catch it, right?
So Centers for Disease Control would say that just passing contact with somebody is essentially not an exposure risk. There are no guarantees in life, but in general, that kind of passing contact, I don't think is the kind of contact we're concerned about at this point.
Okay. All right, we're going to just take a brief pause right now because they're about to come to us on the newscast. So if all our Facebook viewers could just be patient here for a minute. Well, I'm here with Dr. Steve Krager from Clark County, Washington State, and Multnomah County Regional Lead Health Officer, Dr. Jennifer Vines. An interesting question we had. What if I get a package from Amazon that came from a place where we know there's an outbreak? Dr. Vines?
Yeah, so the answer to this came from our early thinking about risk from things made in China and people receiving packages from China. The coronavirus is not a particularly sturdy virus, and so the thinking is that even if it were contaminated at the point of being prepared to be shipped to you, by the time it gets to your hands, chances are there's no virus that could actually pose a risk to you by that point.
And Dr. Krager, how about this question? What should we expect in the coming months? How long will this coronavirus, this COVID-19, continue?
We don't have a good answer to that right now. We are watching this closely, and we are trying to do our best to understand how things are going to happen. And obviously, we've studied what's happened in China. I think that's a decent example. But again, exactly how many people it's going to affect, for how long, we don't know.
And they both say, wash those hands, cover that cough. That's the main way to prevent the spread of the COVID-19 virus.
And stay home when you're sick.
And stay home when you're sick.
Yes.
We'll send it back to you. I'll be out there for the 5 o'clock news, but our Facebook Lives continues till the top of the hour.
No, the one that you hold on, the one that I hold on, that hang on one
Thank you very much. You guys were great. I'm going to bring Shuli in now for our Facebook audience. Shuli's going to continue our digital producer. She's my favorite person around here, and she's going to continue with some of the questions. Thanks, Shuli.
I'm going to bring you a few more questions
I got it.
and for about 10 more minutes.
Sounds good.
This.
I was like, oh, we're done. But you're done.
Jeff has got to go be on
I got
TV,
it.
and I'm just going to ask you.
Thank you so much.
Yeah,
It's
just
nice
a few
meeting
more
you.
questions.
Nice to meet you too. Take care.
Jennifer,
Thanks, yeah.
Nice to see you in person.
Likewise.
Thanks for
Thank you.
being
My pleasure.
So good on TV.
All right, so you can tune in and watch Jeff now. Well, coming up at 5 o'clock. So just a few more questions. Just the last questions. I think we covered a pretty basic, great explanations. How long do we have any idea how long this virus has been around? I keep getting this question, how long it was circulating in China, perhaps since December, January. That is a common question I've been seeing.
So the way we understand it, in Wuhan, China, there was this, they started to notice increased numbers of people with severe kind of lung disease, really sick, and they didn't know why. So they started doing testing, and that was late December. So it probably started just right around then, so 3-ish months, 3.5 months.
Okay. So another question I'm getting, people are getting very specific about their personal illnesses and whether or not that makes them high risk. And so can you just define what underlying medical conditions means? And I apologize if you guys have covered this. Some viewers are popping in and out since the beginning of the hour, so if it's repetitive.
I think it's a great question. We throw it around a lot, underlying medical conditions. We are, again, looking to the Chinese experience and to the emerging science to try to narrow down exactly what that means. I think for now I'm thinking of it as underlying lung, heart conditions. I would include diabetes and anybody who's immunosuppressed.
I would agree, yeah. So specific lung things like COPD and asthma for sure.
Okay, the next question that I'm seeing a lot on these comments is about the pneumonia vaccine. Prevar 13, somebody asked whether or not that could be helpful.
Thanks, Shuli.
Take
So
what you need.
it would not.
Yeah, it's okay. I think they can.
It would not be helpful for COVID-19, but it's a great vaccine to help you prevent other types of pneumonia, pneumonia caused by bacteria, not a virus. So we recommend it for those who it is recommended for, but it's not going to protect you against COVID-19.
Okay.
And I can't miss a chance to promote vaccines. So for people who want to do something to stay well and to stay healthy, being up to date on all of your vaccinations is absolutely a good idea. I want to make a plug again, as I did earlier in the hour, for this year's seasonal flu vaccine, because we know we still have influenza circulating in the community. It is a cough, fever illness that may prompt some worry or somebody to stay home if they're following our advice. Centers for Disease Control is saying that the vaccine this year is a pretty good match to the strains that are circulating. So that is absolutely something that people should do if they haven't already.
I agree.
So when it comes to sanitization and bleach, sanitizing wipes, somebody asked, is it heat sensitive? Does heat kill it? Boiling water often is thought of as, you know, you can clean, kill germs with boiling water. So
I know it's not a very tough virus. I don't know exactly the answer for like how much heat and for how long it would actually take to kill it. Do you know?
Exactly. No, I mean, boiling should work. They think you're supposed to boil for at least a minute, but you know, for cleaning surfaces, that's not going to be very practical.
Yeah.
okay. And one last question about children. People are very concerned about children. I know in China we're not seeing many cases of it affecting children, but is there anything else you can tell us when parents are concerned about their children specifically? How does this affect children?
So you said it already. The best we know from the Chinese experience is that children didn't appear to be the ones among the severe and critical cases. As a parent, I share any concern about children. I think people are also making the connection from past flu seasons, and especially when we had a new flu strain, like we have a new coronavirus strain now. Schools become a quick focus as places where kids mix and mingle, and as any parent knows, trade germs around. And so I think I understand that anxiety. School closure comes up as a question. I can say on the Oregon side, we are not at that threshold yet, but it becomes a potential tool as a way of just slowing the spread of disease in the community. I think less so in this scenario for necessarily protecting children who appear not to be suffering severe consequences from this virus.
I agree. As a parent, I take a little bit of comfort in that preliminary data we have that it's not affecting children as much. And yes, right now we're not recommending school closures, but if children are ill, you should do your best to keep them home.
Definitely.
That is the best thing to keep them safe.
Okay. So let's quickly pivot a little bit and talk about the mental health angle of this. We've been hearing a lot about health anxiety and people who are already anxious about separate issues. Perhaps this contributes to that more for them. So is there any advice you can give to our viewers who may be suffering from that kind of anxiety, heightened feelings right now of nervousness and panic around this? Either of you.
I would say it's really easy if you are anxious about something like this to read as much as possible and try and, devour that news. And I think that is good to an extent, but if it's starting to raise that anxiety and you find yourself that you're not really able to control, take a break. And then there's lots of other things you can do to just, in general, to keep your brain healthy, your mental health. Getting enough sleep is huge. Eating healthy can be helpful. Talking things out with people, if you have a counselor, if you're feeling anxious about something, it's a great thing to talk to a counselor about. Those are some steps that you can take to protect yourself in terms of anxiety.
I appreciate you raising the point. I think it's a great question. I completely agree. I think the only thing I would add, I'm going to guess you would agree, is regular physical activity is good. It's good for anxiety in general. It's good for keeping yourself healthy and strong as we weather this virus.
Okay, so let's wrap it up really quick. Let's just quickly reiterate what steps people should be taking right now to protect themselves.
Okay.
The brief, the basic, cleaning, all of that.
Okay, so the basics. If you're sick, stay home. Don't seek medical care unless you otherwise would. In general, if you're well, there's really no recommendation to wear a mask when you're out and about. People make their own choices. To stay well, get plenty of sleep, physical activity, eat a healthy diet, get all your vaccines up to date, wash your hands regularly, and you can use most routine disinfectants to clean, and especially with some focus on those high-touch surfaces.
Man, I don't have a lot to add to that. That was perfect.
Did I get it? Okay.
I would re-emphasize washing your hands for at least 20 seconds.
Yes.
And the other thing I would add is just be careful where you're getting information from. So lots of people, will put comments on Facebook, and that unfortunately is just not very trustworthy. So trustworthy sites of information, your local county public health, so Multnomah County, Washington County, Clackamas, Clark County. Going up that chain, you can, there's great websites for the state, so Washington State and Oregon, OHA. And then beyond that, the Center for Disease Control, so CDC. Those all have great resources for people to read. And so if you want to stay up to date, those are the best resources.
Agree. Thank you for that.
Fantastic. Dr. Krager, Dr. Vines, thank you so much for joining us on this Facebook Live. And this video will stay available for everybody, and we'll post it inside of the web story. So it will live on for everybody to watch again, and they can go through the comments too. So thank you guys so much.
Thank you.